National Health Service nurses in Britain will strike on Thursday in their first ever national walkout, as a bitter dispute with the government over pay ramps up pressure on already stretched hospitals at one of the busiest times of the year. An estimated 100,000 nurses will strike at 76 hospitals and health centres on Thursday, cancelling thousands of non-urgent operations such as hip replacements and tens of thousands of outpatient appointments in Britain's state-funded NHS. Britain is facing a wave of industrial action this winter, with strikes crippling the rail network and postal service, and airports bracing for disruption over Christmas. Inflation, running at more than 10%, trailed by pay offers of around 4%, is stoking tension between unions and employers. Of all the strikes though, it will be the sight of nurses on picket lines that will be the standout image for many Britons this winter. The widely admired nursing profession will shut down parts of the NHS, which, since its founding in 1948, has developed national treasure status for being free at the point of use, hitting healthcare provision when it is already stretched in winter, and with backlogs at record levels due to COVID delays.
Right now, Kalkine is offering a 7-day free trial on its premium research reports. Get access to data-driven market insights combined with an in-depth analysis on financial markets across the globe. Don't miss it. Subscribe for the free trial now.
Barclay said patients should continue to seek urgent medical care and attend appointments unless they have been told not to do so. The industrial action by nurses on December 15 and December 20 is unprecedented in the British Nursing Union's 106-year history, but the Royal College of Nursing, or RCN, says that it has no choice as workers struggle to make ends meet. Nurses want a 19% pay rise, arguing they have suffered a decade of real terms cuts and that low pay means staff shortages and unsafe care for patients. The government has refused to discuss pay to date. The government in Scotland avoided a nursing strike by holding talks on pay, an outcome which the RCN had hoped for in England, Wales and Northern Ireland, but the Barclay is not budging. The government has said it cannot afford to pay more than 4 to 5% offered to nurses, which was recommended by an independent body, and that further pay increases would mean taking money away from frontline services. The RCN has accused the government of belligerence. It said as late as Tuesday that the strikes could still be stopped if the government was prepared to negotiate. Some treatment areas will be exempt from strike action, according to the RCN, including chemotherapy, dialysis and intensive care units. Polling ahead of the nursing strike showed that a majority of Britons support the action, but once the walkouts are underway, politicians will be closely monitoring public opinion. Alright, that's all for this video, but leave your thoughts in the comments below and don't forget to like and share. For more content, you can subscribe to the channel and press the bell icon. I'm James Preston, reporting for Kalkine Media.